unsolicited, right here in our studio, Jack gets one of those new type colonoscopy products. I've seen these products advertised over and over on TV. I mean, sometimes in 1 hour, you see that one advertising several times, right? These drugs tests, they charge you a lot of money for these products. So that's a baseline. Now, Jack is on Medicare and he received this product unsolicited. In other words, he didn't ask for it. The marketing departments of these drug companies say, look at this. We have somebody who is on Medicare. We can get on welfare by going to the government and having them pay for this product that has a fairly good track rate to determine if you have a polyp or not, or cancer or not, from a stool sample. So they send that to Jack. Jack could have said, oh, wow, I didn't have to call in and get this Cologuard or whatever. I can just go ahead and do the sample, send it in, and they'll tell me if I need to go for further tests, get a colonoscopy, get extraction of what they don't tell you is, whereas, Obamacare will pay for everybody to get a colonoscopy on all these things. When I say Obamacare, I mean the law made sure that Medicare and all these other insurances have to give you that as a part of the insurance. What they don't tell you is if they find a polyp, if they find certain things in you, that isn't covered because it is no longer a precautionary test. It's no longer screening, but it's now surgery. And guess who knew that? Brother Jack knew that. So Jack said, I'm not messing with this stuff unless for some reason I think I need to. In my case, I don't touch any of these things because I understand that our medical system is a scam. But anyhow, so they do that. Why I want to bring this up, and there is a very old drug that got approved for a new diagnosis, if you will, called Xolair. Anybody who has asthma knows that there's this drug that one of the options that they would give you called Xolair. Its other name is omalizumab. Now, this drug, now that it's going to be prescribed for peanut allergies, etc., will run you about $5,000 a month. That's a list price, $5,000 a month. So we have a drug that if your kid has a peanut allergy, can run up to $5,000 a month. That's $60,000 a year. I want you to know that's, even if I remember correctly, either above or close to the median salary before taxes of Americans. It is crazy. One drug for a peanut allergy. If you have one kid with a peanut allergy, or if you have a peanut allergy, one disease in your family can wipe out your entire monies that you probably don't have after taxes, all that good stuff. There's another drug that came out quite a while. My wife, who has lupus, was a member of the trial program for Benlysta for lupus. In my opinion, right, based on the severity of her lupus and even where her lupus is right now, I think Benlysta did very little for her. In her case, we have the results. So Benlysta don't even try coming and say, look, you're maligning our drug. No, your drug for my wife just didn't work. Okay. But I guess it worked for a small percentage of, or enough people that they approved this drug for lupus. You know what has worked for my wife? Working out, eating right, and taking the olden days drugs that's been around for over 100 years. That still works, and it has kept her alive for several decades. Now, for this one drug that keeps her alive, she's paying less than $10 a month. Actually, with her insurance, she pays $0. But I'm saying if she were to buy it out of pocket, it would be $10 a month or so. Old drug. Benlysta will cost her over $1,500 to $4,000 a month, depending on insurance companies, etc. Again, a lot of your money. I want to let you know why I'm presenting the case this way. So that was going to cost my wife if she went onto the trial drug. And remember, let me tell you how evil these companies are. When she got off of the trial, there wasn't no offer that says, since we used you as a guinea pig, you can continue using this drug for life because you helped us develop it. There are a lot of people that are on trials, and after the trials are over, it's not like they get the drug for free. A drug that normally from a point of manufacture usually costs pennies per dosage. Nope. At that point, if she was prescribed that drug to use after the trial, she would have had to pay those several $1,000s for the drugs. Let me explain what I talked to Brother Jack about. Whenever we talk about we need a system at least as good as, let's say, what's in England or the Great Britain, what's in Canada, what's in France, what's in Taiwan. Every single one of them, the people live longer, nobody can go bankrupt, and maybe you want to call it socialized medicine. I don't care what you want to call it. The fact that we allow these corporations to put in our minds that having a one entity pay your bill for healthcare and having your government realize its investment in healthcare, because your government, we the people, we constantly initially develop these drugs, whether it be research at a university or the documents and research capabilities that these universities have given to private corporations from which to develop the drugs, the education of the people who work at these corporations who then develop these drugs from the technology and knowledge they had gotten from being in a public university. You paid for it. And then you come out and you pay for these bills. We have got to be out of our minds to let them convince us that saying, you know what, you guys have been unable to give us a product at a price that doesn't bankrupt us, at a price that doesn't take all our disposable income and more. If you guys can't do it, it means the private sector has failed. And what I'm saying right now in healthcare, based on everybody's concern because of what our healthcare costs and because of the outcomes relative to other industrialized countries in the world, our healthcare system is a failure. We can have the best technologies on the planet, which we do. We have the best technology on the planet, but the marketing and the capitalism that drives the marketing of the drugs is such that it makes it a failure. And until we as a society, until we as people stop being snowed by corporations indoctrinating us, lying to us, having us believe fallacies, what we've earned, what we've deserved, and that is allowing them to mess with our minds such that when a Jack comes out and says, yes, I do believe we need a single payer system. Yes, I do believe we either tell drug companies that any research that was built on prior research from public universities, etc., we the people get a piece of the action. You know what that means? If they want to charge $1 million for a drug, let them. We tax it right back out of them and make sure the drugs are available to people. People, we have to smarten up. The only solution to our healthcare problem, it's a mathematical solution, a single payer system. Also, the drug sector, the ones that invent drugs, aren't really the inventors of the drugs. The drugs are invented from the knowledge that you have paid for to the people at these universities who have developed these drugs and worked for companies who are a failure in delivering you healthcare at a cost you can afford. That, by all definitions, is a failure. And we are marketing, we are supporting, we are investing in a failure day after day. We must stop being hoodwinked. We must stop being fooled, indoctrinated with the fallacies that they come out with. They've studied how to control your minds. Let's deprogram ourselves and start looking for the solutions. Healthcare for all, single payer systems, get the private sector that overcharges out of the development of drugs that ultimately we have already paid for. And when they tell you innovation will stop, meaning inventions of new drugs will stop, I want you to use your minds again. Remember this, most of the people working at drug companies inventing, innovating, developing drugs, let me tell you a magical thing. They are salaried employees. Again, they are salaried employees. What that means is when that drug gets developed and they overcharge for the drugs and you go to Wall Street and you see all the great profits that these guys are making, it's not the salaried employees that are profiting from that, even if they have stock options, because relative to what the executives and the shareholders are going to make from that profit, it proves to you the lie that is, we need to have these high prices to create innovation. That is not true. That is provably false if we decide to open our minds to learn.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel, and number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.